All right, so I am Dr. Allison Egan. I am a naturopathic physician and I work at Tummy Temple here in Seattle. And Tummy Temple, as you know, is a holistic health clinic or fully naturopathic clinic that focuses on digestive optimization. As a practitioner, I have focused my practice on the musculoskeletal system and pain management for the past 8 years. Really dialing in some treatment values to add to my sessions to help with pain. And that's what we're talking about today, is one of those therapies that is under the branch of regenerative injection therapies called neural therapy, specifically neural scar therapy. And so here's just a quick outline of what we'll be covering today. Of course, I'm going to do a little bit more of an introduction about my history, just so you know why I even like this therapy. What is neural therapy? And specifically, we'll go into the scar therapy itself. Why scars? Why do we care about scars? Why they're important to treat? And then also the protocols and regimens I have for this kind of a treatment. And then at the end, I'll wrap up with a few case studies, some interesting cases I've seen over my treatments, and then we'll have time for some questions. And of course, if you have any questions through the talk, feel free to add them into the chat, and I will make sure to answer those, just so that you don't forget as we go along. All right, so I'm Dr. Allison Egan again. My background before doctoring, I was an avid outdoor enthusiast and professional. I've always had a strong belief that activity is important to overall health and longevity, and I still do to this day. And that's probably what grounded my interest in naturopathic, not just naturopathic medicine, but musculoskeletal health and regenerative injection therapies. It helped guide me to naturopathic medicine as well. Okay, so as an undergrad, I was an athlete. I was a rower. That's me right there, second seat. And then after undergrad, I was a backcountry guide, both backpacking and river guide. Still very important in my life to be outside and active. Since moving to Seattle, I started sailing, sail racing, and all these things lead to a lot of injuries. Being active, it's an inherent risk to injure yourself, and so I've definitely had a lot of injuries, and to heal myself, I found assorted ways to do that, and one of those has been through regenerative injection therapies. And I'm a big proponent. Anything that I'm going to recommend to my patients, I've pretty much done myself too. So I've been poked and prodded a lot over the years through my trainings, and also just through therapeutic value, for therapeutic value. After medical school, I was awarded a highly competitive residency in rheumatology. And this was an intense experience that combined both conventional medicine and holistic naturopathic treatments. And that's where I first was introduced to regenerative injection therapies. And this accelerated clinical education is really what dialed in my ability for physical assessment and the ability to address lifestyle issues related to pain and management in my patients. The years since residency, I focused more on continuing education hours in regenerative injection therapies, and specifically things like neural therapy, which we're talking about today. So what is neural therapy? It's just not as fun not having the transitions between slides. So the aim of neural therapy, as it says here, is to reduce pain and dysfunction. That's pretty broad. Neural therapy is a gentle medical treatment involving the injection of local anesthetics at low concentrations into the soft tissues of the body, near and around nerves, specifically nerve bundles, scars, glands, acupuncture points, and trigger points. It's a medical system treatment system that was developed by German physicians in the early 1900s, and it's widely used in Europe as part of primary care. Based on the approach that the body's nervous system, and all systems really, are interconnected, and that disruptions in the body's networks can cause physical and psychological issues. This can be used for treating chronic pain and assorted systemic conditions, so medical conditions. The goal being to reduce inflammation, improve nerve function, and restore balance to the body's networks. The goal of reducing pain to improve overall health and function. So scar therapy is just a piece of neural therapy. As I mentioned, there's all these other areas that we can treat, from nerves to nerve bundles, trigger points. And scars are often just a point of disruption along nerve paths. I often get asked, what are we using for the injections? And traditionally, and what I prefer to use is Procaine, and it's a dilute anesthetic. So I dilute the Procaine down to 1% and inject it into the areas of treatment. And so sometimes I can use lidocaine, and if someone does have a sensitivity or an allergy, there's other things I can use, but I tend to find Procaine is the most effective. So why scars? So scars are abnormal collagen crosslinks. So it's the result of our immune system basically triaging an area, and they're intended to restore function to a damaged area. So whether that scar is a paper cut, it's a rolled ankle, it's a bruise, it's a traumatic injury like abrasion or a surgical scar. Basically, normal tissue, and this is the description I give to all my patients who come in for this treatment, normal tissue is very organized, right? So it's very linear. You look at it and it's very organized pattern. Scars are abnormal collagen crosslinks where there's just this mishmash of collagen that's been thrown onto an area of injury that is dysfunctional. It's not as organized, so it doesn't allow flow to go through. And by flow, I mean neurologic flow, lymphatic flow, blood flow. And so obviously if those things are disrupted, those flows, it's going to cause dysfunction, either directly in the area or in a referred pattern. Quick question, little involvement here that you can write in the chat if you want, or I guess since we only have 2 live right now, or I guess we have 3 now, you can turn on your mic and answer. Do any of you know how long it takes for us to heal from an injury, like timeline in weeks, months, or years? Just a guess. Anyone? No response.
How severe it is.
What? Yeah, I mean, it depends how severe it is. It's caveat.
If it's nerves, isn't it 7 years?
Could be. Yeah.
Could be.
So typical tissue injuries, even if it's like a paper cut, it's upwards of a year. And the reason for this is that there are phases to healing, right? There's 3 phases of healing. I actually have this on the next screen. So wound healing, here's hemostasis, so that's normal tissue. So inflammatory, proliferative, and remodeling. Those are the 3 phases of healing. And then this diagram here shows over a timeline of how long those phases last. And I would say this is even spread out more. I would say it mentions they overlap. I would say they overlap a lot more. The first phase, this inflammatory phase, is where that triage happens and all the collagen crosslinks are laid down and your body is literally putting an internal bandage over the injury, right? So a scab, basically. Your body is just triaging, trying to stop blood flow if it's present so we can sustain life. The second stage, the proliferative stage, is after that's calmed down, the inflammation isn't as critical, your body starts proliferating something called fibroblasts. And fibroblasts are a immune cell that come in and gobble up excess tissue, like those collagen crosslinks. And that's where the remodeling and proliferative phase kind of start to overlap even more. I think remodeling starts a little bit earlier than it's saying in this graph. And the problem is, as we get farther and farther away from the initial injury, it's less and less of a direct insult to your body, a direct risk to life, so to speak. And your body tends to forget about that injury because we are dynamic living beings and there are injuries happening all the time at the microscopic level throughout our body that our body is triaging. And so that paper cut on your finger isn't as threatening 2 weeks from the time it happened than it was, 1 minute into it happening. So your body tends to forget once it's got all that collagen cross-linking down, and it kind of walks away. So oftentimes those scars will stay really knobby and dense much longer than they need to, and often forever if left untreated. And as I mentioned before, up here, it's a site of dysfunction. And then often it's also a pain generator, either triggering a site of referred pain because it's blocking that flow, or it's creating pressure in that point because there's all this dense tissue putting pressure onto the local nerves. Okay. Any questions about that? No? Okay. So what is neural scar therapy as a treatment? It's basically a direct injection to the site of the scar. So parallel to the scar, if your scar is here, I'm injecting and threading a needle through and injecting alongside of it. It's very superficial, very low risk of injury. The main causes of injury from this treatment would be a reaction to the injectables. Most of us have had some sort of local anesthetic through our life, and it's very uncommon to be allergic to them. I always, of course, check in with this, and most people would know if they are by the point of time they're seeing me. And then it's, of course, a sterile procedure where I am cleaning the skin very well. I am using sterile equipment. I'm gloved up. So its risk of infection is very, very low as well. So the direct injection does two things. One, it is reducing the mechanical pull that those scars are having on the local tissue. So it's actually causing another micro trauma to the area to remind the immune system to come back in there with those fibroblasts to remodel the tissue. And then it is also the use of local anesthetic itself, specifically procaine, works by the metabolism of procaine is local, so it doesn't get metabolized through your liver. It's metabolized in the tissues, and the metabolites from the procaine actually help to soften the scar. So twofold. Mechanically, we're reducing the pull on this healthy tissue, and we are softening the scar itself. The amount of solution just depends on the size and density of the scar. The treatments itself, usually there are, it's not a one and done type of a treatment where one treatment and you won't have any more. It's usually, I recommend you plan on at least 3 to 4 treatments, 2 weeks apart. Again, because of that timing, we don't want to treat in the inflammatory phase. We want to treat in this proliferative phase. So that's about 2 weeks apart. And of course, at every treatment, we are assessing the scar itself. We're assessing your symptoms and your response from the treatment, and determining next steps. So it's very rarely have I had someone need less than 2, like 1 treatment, and they're totally much better. It's but I have had people come in at their 3rd session, and I'm pretty convinced they don't need a treatment right then. Typically, older scars will take more treatments. Denser scars definitely take more treatments. I have had a few who've had upwards of 10 treatments. before we go into more of a maintenance. Maybe they'll need to come back in the future, but I haven't seen them back yet, sort of thing. Um, and that's basically the treatment protocol and how the treatment is done. Any questions about that?
Are you, so I would just assume if it's a larger scar, excuse me, like an abdominal scar or something from C-section, let's say, would there be multiple injections at that treatment? Like you have to go in at multiple locations or just like one?
Yeah. So, a needle is only so long. So if it is several inches long of a scar, it's going to be several pokes. And then also just depending, I'm watching how the injection goes, and sometimes I have to inject the same spot a few times. It's, but yeah, plan on each treatment being several pokes, even if it's a smaller scar, because sometimes I have to get at it with different angles to see the proper distribution of fluid under the scar.
Sense.
Yeah. And of course, it is a local anesthetic, so it does numb it a bit. On really sensitive areas, like the face or the hands, I will use a topical lidocaine solution as well prior to treatment, just to help numb it even more. Typically, like legs and abdomens and backs, most people tolerate those injections pretty well. I have done a lot of C-sections. That's a really common scar to have treated. And those can, particularly if it's an unplanned C-section, can bring up an emotional release because there are emotional ties to a lot of scars. And so I do warn my patients about that as well, that, if this scar has a history and you've never had work on that scar, it could bring up the emotions that were present at the time of getting that scar. Because it's a somatic response, right? It's a holding of that energy. But yeah, it's not. I don't like to sugarcoat things and say, "Oh, it's a pleasant experience." It's injections.
Yeah.
I try to be quick, and most treatments are less than 15 minutes in total. And it's not like I'm injecting that whole time. There's a cleaning, there's assessment and everything. So it's not totally painful the whole time. And as soon as the needle's out, it's usually the pain is gone. It's just while it's being injected, it's a little painful.
Yeah, makes sense.
So I have a question. So people who are having their scars treated, is it because they're having issues with it, or can there be issues, if you're not feeling pain or having any problem with it, is it you just don't need to do it, or is there stuff that's happening even if you aren't feeling, like if it's a really old
Yeah.
scar, that type of thing?
Interesting question. Because of the referral patterns that scars and the inference that scars can create on our whole system, it can cause symptoms that are completely unrelated to the scar. And I'll explain this a little bit more in my case studies coming up, because I have a few case or a couple of cases that it was seemingly unrelated things resolved to the scar being treated. And I see that a lot. And at this point, I kind of tend to notice when someone has a other complaint, and this is how I end up doing a lot of treatments, is someone is seeing me for something completely different, and we find out that there was a surgery or a scar either near or somehow related to that sensation or the symptom they're coming to see me for, and we'll treat that scar and it will help resolve that problem. A few times, like recent scars or really like a recent injury, people will come to me specifically for the scar itself. But honestly, people are coming to me for other things first, and then I treat a scar and it resolves that thing. Did that answer your question, Melissa? A little bit?
It did. The other question I have is, so like I have scars. For last year I had 3 different surgeries on this area, but I didn't develop any pain or whatever for over a year later. So now I'm having frozen shoulder and nerve pain down this side.
Mhm.
So is that, I'm assuming, could that possibly be from the scars, or would it happen right away?
It can be from the scars, and oftentimes because scars are also very um they're not just superficial, right? They grow. So the scar tissue along the fascial plane creates more adhesion in fascia. So that's really common where you'll have a surgery and the adhesions in their fascia will grow deeper after the superficial cut, right? Or below the superficial cut or in that area. And so, yes, it can be from the actual surgery causing more fascial adhesion that's not, maybe directly related to that scar. But another reason, backtracking to the procaine itself that I like using procaine is because of that metabolism in the tissue, it penetrates deeper than where I'm actually treating, right? So it's a very superficial treatment, but it works deep. And so it can work on that deeper adhesion of the fascia. So yes, it could be. All right. We'll have time for more questions in a bit, but let's get into some case studies because I think this is where it's really interesting. And I actually had a little bit of trouble picking a few cases because pretty much every scar I treat, there's some sort of response that is amazing or just unexpected in a good way. And so I could literally tell you about every scar I've treated and there'd be something exciting to share. So the first one is someone who I saw for quite a long time. She's a 43-year-old woman. She had this abdominal surgical scar, and I do a lot of abdominal scars because I tend to find they have the most impact on organ health and just like diffuse systemic problems musculoskeletal wise, because it's our central core. And so this one, it was a 20-year-old scar. I think it was more than 20 years, from exploratory surgery after a motor vehicle accident. So she was basically thrown from a car, and it was like, it's a miracle she's alive, basically, is her story. And she was in a coma for a few months after this accident and woke up and her body was just a wreck, right? She had been a professional dancer, very physically active. I think she was 19 at the time. And they had to do this exploratory surgery because she wasn't conscious after the accident. And her scar was about 7 inches long, just right down the middle of her belly, down around her belly button and then below. She'd had a few pregnancies, and the pregnancies themselves was interesting. Spread the scar, the lower part of the scar, and it's almost like was a natural scar therapy in a way to have that tissue spread, because her lower part of the scar was actually much softer and smoother than the upper portion from around her belly button and up. Around the belly button was very puckered and wrinkly, and it made her superficial abdomen look very lumpy. And again, she's still a very active woman, fairly thin, but she just didn't like how lumpy it looked. And honestly, she wanted this treatment more for aesthetic reasons, even though I don't ever guarantee there's going to be an aesthetic change after this treatment. It almost always makes the scar look smoother and softer, but I can't guarantee it's not going to make the scar disappear. That is very, very rare, especially a scar of this size, because it was also very wide. It was about a ½ inch wide. And so she also, again, because of that accident and also her lifestyle being very physically active, she has a lot of other musculoskeletal complaints. One of which was piriformis syndrome, which piriformis is a muscle in our bums. It's kind of a problem child for a lot of people. That's why they have this whole syndrome where it can just ache and it can cause sciatica. And she would wake in the middle of the night and have to either foam roll or Theragun her piriformis for 45 minutes and to be able to go back to sleep. She couldn't sit in a car for more than 30 minutes without pain. Any sort of travel was horrible. It was a really big complaint for her. But that's not why we were treating the scar. We were treating the scar more for aesthetic reasons. And so she was very open to the treatment and did one session. I saw her 2 weeks later, and she reported that her piriformis syndrome was down 75% within a day of the treatment. And that she had pretty much slept through the night, and she was able to go on a 6-hour car drive with no pain. So that was pretty impressive to me. The scar itself looked a little softer. It wasn't, like I said, I don't expect a lot of aesthetic changes. I don't promise that, but it did look softer. We proceeded on doing, because she was sold after that with the improvements of her piriformis syndrome. We did upwards of 10 treatments overall. Eventually, shrinking the treatment size. So I wasn't treating the full scar by the end. I was just treating kind of the really puckered areas. And by the end, her scar was much, much smoother, definitely much less dense. And the color was almost normal skin tone. It had been a much more red tone before. And her piriformis pain was pretty much gone. So that was a pretty cool win. And so that's one of the examples, Melissa, of, it was something completely unrelated that was being affected by the scar. It was probably a fascial line that was being pulled from that scar, causing the pain in her piriformis. My second case, this is a newer client. I've seen him, I think, 4 times now. He's 56-year-old. He had, it was open heart surgery, I think a couple bypasses. Anyway, full, cracked the ribs open, big scar down his chest. And ever since then, he had pectoralis pain and also some thoracic pain in his upper back. It's a very, very dense scar, particularly the lower part on his lower sternum. It's very, very dense and puffy and very, very red. It almost looked like it really wasn't even close to being done healing after a year and a half. And he had some reduced range of motion in his left arm. And his goal was obviously to reduce that pain and increase the range of motion. Definitely saw an improvement in the scar with one treatment. And his pain, especially his pectoralis pain in that muscle in his chest, has greatly reduced. And his arm is, I think he has pretty much full range of motion now of that shoulder. And I've done, like I said, I think 4 treatments. I just saw him 2 weeks ago. And I don't think we're done, because the scar, while it's gotten much, much less dense, it's much softer, much less puffy. It still has a ways to go. But his pain and range of motion are greatly improved. And so now we've decreased, we're not coming in every 2 weeks. I'm just having him come in once a month to help reduce the size and density of that scar. But that's been really impressive, because he noticed, and his wife noticed within the first week after the first visit, that it was much softer. So that was another interesting case. And this last one, 73-year-old woman, she had a double mastectomy about 15 years ago, and then implants placed about a year after that. And this is one I've seen a couple times as well, where she had basically a mild frozen shoulder in her left arm, left shoulder. I don't remember if it was since surgery, but in recent years, it's definitely become more apparent. And the goal was to improve shoulder range of motion with the treatment. And so I treated the mastectomy and implant scars just on that left side, really. I didn't even treat the right side. And in the visit, and this is what we call a lightning response in neural therapy, in the visit at the end, she was able to raise her arm completely above her head. She wasn't able to raise her arm more than 90 degrees, and she was able to go a full 180 after the treatment. So that's what we call lightning response, where it was immediate, didn't even need the treatment to sink in. It just, that's what needed to be treated. And I've treated a couple times since, and she continues to have full range of motion. And that's one, even though it was an old scar, I only had to treat it 3 times. So that was a good example of that. Any questions on those case studies? Any questions at all? All right.
If you have multiple scars, like how do you decide where you're going to start? Are you starting where there's pain or some other symptom, or do you, by the way the scar looks, or how do you decide?
Like multiple scars from the same injury, or
No.
from like all over your body? Yeah, so it depends a little bit on the history of the person and what their goals are. For example, since you shared this already, you're having shoulder issues, I'd probably treat all the scars related to that shoulder injury and or surgery starting, and then we would go from there, right? Typically any big surgery is going to be my first treatment. And I have had it where, and I think this happened with that case, the abdominal scar case, I just treated her abdominal scar to start. And after that treatment, she's like, oh, let's treat, from that same injury, she had like a port scar from where they had to drain something in her, the side of her thoracic, side of her rib cage, I guess. And then she also had like another scar from that motor vehicle accident on her arm. And she just wanted me to treat them because she was so convinced that this therapy was doing a lot for her. And so we treated everything related to that motor vehicle accident. And so it's case by case based on their history is how I decide to treat the scars, if they have a lot of scars. And like I said, most people aren't coming to me for the scar therapy, right? It's mostly people are coming with another complaint, and I'm treating the scar that's ends up being related to that complaint. And from there, it's just a natural progression to treating other scars if needed. I mentioned this earlier, but I find that abdominal scars are particularly feisty when it comes to causing problems. And so typically if anyone in a history or on their intake form with me mentions that they've had an abdominal surgery of any kind, I will recommend it, and I'll mention the scar therapy. I've treated a lot of cesareans, a lot of gallbladder removals, a lot of appendicitis, and quite a few exploratory abdominal surgeries. So those are really common ones. When someone comes in with the knee pain and they happen to have like an old scar around the knee, I'll treat that, whether it's a traumatic scar or a surgery scar. I'll treat the scars with that too. And I've seen the knee pain like almost fully resolved with that. Any other questions? Okay.
Feel free to put them in the chat. Oh, Janet.
I was just curious on how you the neural therapy would work with like a hysterectomy that was done laparoscopically, like with a Da Vinci machine.
Yeah, great question. So that's something I would treat not with scar therapy, but just neural therapy. There are, as I mentioned, it's a whole.
Right.
Scar therapy is just one component of neural therapy. And with neural therapy, there's systemic treatment patterns that we use. And so there's a specific pelvic pattern I'd probably use to work with that.
And what about trigeminal neuralgia? You would use a similar pattern?
Yeah, there's patterns and specific nerve bundles we work on treating for that.
Okay, thank you.
Yeah. So again, thank you for your time and listening to me ramble about neural therapy and things I love to do. Here is my contact information. Again, I'm a naturopathic physician at the Tummy Temple in Seattle, and my email, dregan@tummytemple.com. You can read my full bio at tummytemple.com and see all of our services if you're not familiar. And we are also on social media. Tummy Temple has Instagram, Facebook, and YouTube. I have Instagram and Facebook. You can just search for Tummy Temple or Dr. Allison Egan. Find those. Learn other interesting health tidbits and information along the way. And again, as a thank you for sitting through my ramblings, we're offering 10% off if you do come in to see me for neural therapy at Tummy Temple. Just mentioned you were in this class at checkout, and also that's why we need make sure we have your emails in the chat so that we can send you a follow-up to this presentation.
Yeah, so please put your emails in the chat. If you can send it directly. If you don't want everybody to see your email, you can direct it at someone, either myself or Dr. Egan specifically, if you want to message them or her or me. So, all right. If you want to stop sharing your screen, Allison, then I will do a quick presentation here. So thanks, that was really interesting. I talked to Dr. Egan about this before because I'd seen some clients recently that had scars, and it got me thinking about this because I think it can be really complementary to what we do here at Egoscue. So I know we spoke at the beginning, there was Gwen is familiar with Egoscue. Is anybody else? Is this like a brand new thing? Yeah. Okay, cool. So let me pull up my slides. Share my screen. Okay. All right. So Egoscue method. It comes from, the name is weird. I know I won't test you on the spelling or the pronunciation, but it comes from the founder's last name. So Pete Egoscue came up with this method. And it's basically, as we'll talk about in detail, but it's all about posture and body alignment. So we help people mostly who are in chronic pain, but our approach is to look at their structure of how their body is positioned and how they move, and figure out where things are, working less than ideally. And we use exercises and stretches to correct that. So it's a hands-off therapy, right? So I don't do any hands-on stuff like a chiropractor would, but it's teaching the client things that they can do to help themselves, which is pretty great. So just a real quick about me. I have two wonderful daughters there. And I've been doing this Egoscue stuff for probably about 9 years now total. I've been in Seattle for 7. Before that, I was in Portland as a therapist. They have a clinic there too. And then prior to that, I studied exercise sciences and got my bachelor's and master's degree in that. And that's when I learned about Egoscue. And so it was something that one of my professors introduced me to. And at the time I thought, well, I just really liked the idea of it. This notion that, you can heal from chronic pain by simply doing some basic exercises and stretches to correct your posture. So of course, being the 22-year-old or however young and seemingly invincible, I thought this was something that would just be for old people, right? Like, it wasn't something I needed. But I actually started playing a lot of racquetball in grad school, and then I started developing some shoulder and back issues myself. Started to interfere with my sport, and so I thought, well, maybe I should give this Egoscue thing a shot. And sure enough, I had a little assessment. I was able to see exactly how crooked my body was. And then I started doing the exercises and felt the improvement right away. And so really helped me get out of pain. And I wanted to help other people achieve that same goal. So That's what got me into this. And so on the left here, I just have, this is a group of other Egoscue therapists and clinic owners from across the country that we get together every now and then, and for continuing education and stuff. But here we're playing pickleball, and that's lately my sport of choice. I don't play racquetball much anymore, but I've transitioned to pickleball. Anybody here play pickleball by chance? Yeah, Gwen, nice. It's really fun. I don't know anybody who's played it who didn't like it, so highly recommend. All right, so posture we're talking about, most people just think of like probably their moms telling them when they were little to stand up straight or sit up straight, right? But it's really encompassing the whole body. And the reason it's important is, as you can see with this house, like obviously it doesn't look safe. I mean, I'm surprised it's still standing, honestly. but our bodies are the same way. If we're not stacked up, you know, in straight lines and, you know, the way our bodies are designed to be, then we're just going to be less stable. We're more likely to hurt something. Think about all the stresses placed on these walls, and the roof is caving in. I mean, the floor, it's just a mess, right? Maybe some of you can relate to this when you look in the mirror, right? But our bodies need to have proper alignment if we want them to be strong and be able to be active and, you know, be out of pain. So we're designed to move. Our bodies, you know, we're moving machines. It's really what we're designed to do. And I think in general, we all moved more when we were younger. You know, we played, we ran around, we tumbled, we crawled, we jumped, we climbed. And now we mostly sit on our butts, maybe play some sports recreationally, go to the gym for a half hour, whatever. But in general, we're just not moving as much as we should. And so that causes lack of, you know, we don't use our muscles well, and so they stop working well. So we develop these imbalances or patterns in our body where we may be strong, we may be, you know, relatively functional, but there's usually some kind of dysfunction, and it can be caused by other things too, not just inactivity. Going back to the scar topic, you know, I see this a lot where people have had an old injury, maybe something that was entirely out of their control, like a vehicle accident, sports injury, a surgery for something else, right? And our body compensates for that, meaning we have something that's not working the way it should. Maybe it's hurt, and our bodies try to avoid that, and so other areas have to take over. You know, you sprain your right ankle, you limp on it for a while, you start putting more weight on your left. Maybe it's really bad, you had to have surgery, or you're in a boot, and then you really have to change how you walk, right? Or don't walk. And so even after your ankle heals, your body's still, if you don't do something proactively to retrain and get your right side and left side doing what they're supposed to again, you can carry those patterns on, you know, for years and, you know, rest of your life if you don't change something. So that's kind of what we deal with, is we're trying to just get our bodies to function back the way they're supposed to. And when they do, your body is pretty capable of healing and functioning like it should through our whole life. So talking about posture, this is what we mean. It's encompasses the whole body, and we focus on these load-bearing joints. So we've got ankles, knees, hips, and shoulders. We want them to be stacked up vertically, one right on top of each other, and horizontally. So the shoulders should be level with each other, the hips should be level with each other, etc. So that creates a pretty symmetrical body, right? We'll put a line down the middle, and it should split you right in half, equal distance between each of those joints. Right and left side should look the same. Our feet should point straight ahead, our knees should point straight ahead. And then the side view is pretty similar: ankle, knee, hip, shoulder, and then also the ear. So that's an indication of your head position. It should be stacking up over those other joints too. So anything that's deviating from that is going to potentially cause problems. So a little practice here for now that you guys are all experts in posture. All right, 5-minute crash course. But Go ahead and unmute yourself, or you can put it in the chat if I just want you to point out anything that you see here with this guy. This is a real client of mine, a former client, I guess. This was on day one, you know, he came in at various pains, but what do you see that looks different, or what's off compared to the ideal?
The right hip is high. There's more space on the upper right quadrant in terms of the line. It looks like, it's hard to tell with the shorts, but it looks like the knees aren't level either, but it's hard to tell.
Yeah.
Um,
Good.
Yeah.
You definitely nailed his right hip over here is higher than his left, right?
mhm. And on the left, yeah, and on the left, that space is,
Right. Yeah, he's
Yeah.
basically shifting his weight to his left, right? So there's more of him on that side. Yeah.
mhm,
Like
You see
forward
anything
head
else?
posture and shoulders.
mhm.
Yeah, the side views aren't looking too great either, right? His head's, remember the ear is supposed to be on that line, and his head's barely touching it, so he's pretty far forward.
Yeah.
And that's a good reason why we have to look at the whole body, because if we just looked up here and said, oh wow, his head's really far ahead of that line, so he must need to straighten out his neck, right? So you might see recommendations for like chin tucks and neck strengthening exercises. But what's really going on here? Look at everything below it. I mean, his pelvis is ahead of the line, his shoulders are ahead of the line. So even if he tried to pull his head back, he couldn't get it where it's supposed to be, right? He has to get everything below it stacked up properly too, right?
Is his knee technically up in front of the line too?
Yeah, because it should be more like just basically right in the center, like center of the mass of the knee.
Yeah.
So probably a good inch or so forward. So yeah, so
You
here
can.
is this, I think it was about 2 months, I want to say 2 months ish later. So
Yeah.
what do we see that change other than he's wearing a shirt?
Yeah.
Looks pretty good, right? What specifically is different?
Much more balanced.
Yeah, much more in the mid. Yep.
That balance, like right to left, so he's on the line now, right down the middle. So he's looks like he's got his right and left side look more or less the same now, which is great. How about that side view?
A lot better than.
Yeah.
Yeah. So just imagine how much less stress is on his back, his neck. I mean, everything now than it was here, right? So he came in with back pain as his primary complaint. He had some other, knee issues and things too, but it just makes sense. Like, it's a simple concept, but here, when your joints are out of position like that, it's just and that's him standing relaxed, right? But think of there's so much muscle tension on his backside of his body just to keep him from falling forward, right? Because there's more of his weight is ahead of that gravity line. So it takes a lot. It's less efficient, right? It takes energy just to stand up. Well, it takes more energy to stand here than it does here if everything's working the way it should. So, and really the only difference was he did his due diligence with his exercises. So it's not a quick fix in the sense, well, it can be. Oftentimes people in their very first session will walk out the door feeling much better than they came in. But ultimately, to correct these issues, they're long years in the making sometimes. And so it takes some time and repetition to change your muscles, of course. But it can obviously be done. So here's a couple other examples just to show, this guy was in pretty bad shape when he came in, obviously bent over, couldn't even straighten out his back. He was in the middle of a back spasm. If any of you have had that, it's not fun, right? But this is another kind of extreme, but I like to show this because it shows that even with these extreme postures, and you might look at that top picture and think, oh, wow, she's like, seems like there may not be hope for her, right? Like, she's bent over and that's her trying to stand up straight, right? So it just seems like, oh wow, maybe she needs surgery or a back brace or something, like, right? All it took was, the right exercises and time on the floor, basically, to allow her body to straighten out a bit. And it's still not perfect, but she's on the right direction now, right?
Do you know the time between the first or the two photos?
This was the same day. This was before and after the first session. Yeah, this was day one and day one post. Yeah, so pretty dramatic. Yeah. And just to show that this isn't just a thing for older people, it's for everybody. We have a client on the left who's, in good shape, he's fit, he exercises, but he's out of balance. And as a result, he had various pain in his shoulders and arms, and with his work that he did and exercise, he was always getting hurt. And you can imagine why, right? Just how things are not where they should be. And so it just puts our joints in more stress whenever we have to use them in a less than ideal position. So, and then the lady on the left, I like this because I just think she looks younger in her after photos, right? I mean, other than the gray hair, she looks much younger because her posture is in more ideal position. Shoulders are less slumped, her head is back, she has a nice curve in her spine again. So just shows how it's never really too late, regardless of where you're starting at, you can make changes to your posture at any time. So, and we're going to get to experience that now. So this is a little, we're just about out of time here, but I'll try to be quick. I want to show you guys something so you can experience a little bit too. So let's stand up if you don't mind. And if you don't mind having your cameras on, that way I can check your form, that's great. But we'll be, barefoot is ideal. Well, socks are okay, but slip off your shoes if you're wearing any. Just march in place a few times, kind of shake it out. Let me stop sharing this so you guys can see better. So I just want you to stand however you feel is natural for you, right? So I know you just looked at the picture so you know what you're supposed to look like, but don't look at your feet maybe, and just stand how you think is normal. Close your eyes even if you want to, and just check in with what you're feeling on the bottoms of your feet. Notice where the pressure is. It may move around a little bit, but just as you stand still, where do you notice the pressure? Is it on both of your feet evenly, or maybe you feel like one side feels heavier? You might feel more on the balls of your feet or more back on the heels. Could be more on the inside edge or more on the outside edge. So anybody care to share where they're feeling the weight on their feet right now?
Outside edge for me.
Outside edge.
Mm-hmm.
Mine shifts quite a bit, but I feel a little bit more on the lateral edge of the left foot, a little more tension into the toe area on both feet, a little bit forward. Yeah, and maybe a little bit more pressure on the left foot.
Okay, great. Good body awareness. So, so this is the reason I ask about your feet, is because that's just one way that you can feel how balanced your body is. If you think about that example posture, the perfect posture, everything was stacked up properly, you would feel same thing on both feet, first of all, and it would be equal front to back. So on the ball of your foot, kind of the pad below your toes, and your heels should bear most of the weight. So if you're feeling anything different than that, maybe more on one side or more on the outside edge, more on the front or more on the back, like that's just an indication that your body's just in a slightly different position, and that's what's causing the weight to feel different. So we're going to go through a couple exercises now and see if we can affect that. So first thing I want you to do is look down at your feet, and let's actually get them straight now, because I bet most of you were turning them out a little bit, right? So point them straight forward. That means the center of your feet, like your second and third toes, should be pointed straight forward, not just the big toe, but